Coloboma, what is that?
Coloboma is a congenital defect, and what normally happens when the eye develops, it develops in certain sections and it fuses together. If it fuses together and a part of it isn't developed properly, it'll leave a defect. A coloboma is a defect in either the lid, it can go back to the iris, and it could go as far back into the retina and into the actual optic nerve, and it's tissue missing. Congenital tissue missing. If it affects the retina, it can actually make the child be blind in that eye. I have a number of patients who have colobomas of the retina and optic nerve where they see practically nothing. Sometimes they'll see 2400 if the macula is involved. If the optic nerve is involved, they can have no vision. If it affects outwardly the eye, you'll see that they have kind of like a keyhole type of pupil if it affects the iris. A coloboma of the iris is very noticeable if you look into a person's eyes because you'll see a piece of the actual pupil missing and the iris is missing. If it affects the lid, they can actually have a notch in their lower lid where it's actually apart and it looks like there's a defect in the lid.
This is not too common, is that true?
No, it's common enough that you'll see 1 or 2 colobomas coming into a busy practice, an ophthalmology practice, maybe every 2 or 3 months. So it's not so uncommon as 1 in 15,000 births, but it's probably more like 1 in 1,000 or 2,000 births.